Hello, my name is Dr. Mark Bell. I've been practicing here in Salina in ear, nose, and throat for about 38 years, and I joined the Salina Regional Health Center staff about 6 months ago.
Well, Dr. Bell, thank you so much for being on the show. I do want to thank whoever started calling otolaryngologists ENT doctors, ear, nose, and throat, so I didn't have to pronounce it all the time. I want to have you, first of all, say what kind of diseases and conditions do you treat?
Well, otolaryngology, or ENT, is a real varied specialty. We deal with ear diseases, both medically and surgically. We repair eardrums and middle ear spaces, sometimes do mastoidectomies. With the throat, we treat a lot of medical disease in the throat, reflux and things like that. Diagnose vocal cord problems and speech problems, swallowing problems. From the nasal standpoint, nasal disease like allergies, sinus infections, sinus disease. So basically everything above the shoulders except for the brain cavity and the eye socket.
Okay, so how much of the practice is surgical versus medical?
It's decreased a little because medical treatments have gotten better, so there's not as much things or not as many things that we have to go in and do something surgically. But right now I'd say it's probably 30 to 40% surgical and 60 to 70% medical. Third, or a little bit more of our practice is kids, always has been. Everything from as simple as tubes and tonsils and adenoids to treatment of congenital abnormalities.
As a parent of four, I think I saw a lot of ear infections, okay? I think only one of mine had tubes. So at what point in time should a parent bring an ENT into the equation when a child is having ear infections?
Well, a lot of people think if a child has fluid in an ear or has had 2 or 3 ear infections that there's some magic number where then they need tubes. In actuality, tubes aren't really indicated just for recurring infections. If those clear promptly and the ears come back to normal, that's not uncommon. In the vast majority of kids, that's what happens, and they outgrow it without needing any sort of surgical involvement. Tubes are more for the child whose ears will not clear, and because they're not cleared, then they get recurring infections. If we see the kid who's had several infections, but every time they do, the ears are perfectly normal in a month or two, that is not really an indication to put tubes in.
Thank you so much for coming on the show. And thank you for watching. For more information, please go to srhc.com and you may look at the Ear, Nose, and Throat Services tab, and like Salina Regional Health Center on Facebook, follow us on Twitter and Instagram.